Welcome, doctors. If you've been thinking about hiring a virtual medical assistant, or maybe you already have one, you've probably asked yourself the same question many practices are now asking. Is this HIPAA compliant? Because while VMAs can seriously lighten your workload and boost efficiency, they also handle sensitive patient data. So making sure everything stays compliant isn't optional, it's essential. Let's talk about why VMAs are becoming such a powerful asset in modern practices. These aren't just remote admin workers, they're trained professionals who manage scheduling, billing, insurance verifications, charting, patient messaging, and even triage support. They free up your time so you can focus more on patients, not paperwork. Practices using VMAs report fewer errors, lower overhead costs, and smoother day-to-day operations. In fact, in just the last 2 years, adoption of VMAs in U.S. healthcare practices has jumped more than 30%. But as more practices make the switch, one thing becomes clear: efficiency means nothing if it puts your patient's privacy at risk. Now let's quickly revisit what HIPAA actually is. The Health Insurance Portability and Accountability Act is the federal law that protects all forms of patient health information, medical history, insurance data, treatment notes, you name it. If your VMA is accessing that data, and they likely are, then they need to be just as compliant as your in-house staff. That includes following specific rules on how patient info is stored, shared, and accessed. Some clinics bring on a VMA and forget to sign a Business Associate Agreement, BAA. Others let assistants use regular email or free file sharing tools that aren't encrypted. Some forget to provide HIPAA training or share login credentials without tracking access. These are easy mistakes to make, but they can have serious consequences. Data breaches, government fines, lawsuits, and worst of all, the loss of patient trust. So how do you protect your practice while still enjoying the benefits of a VMA? A compliant VMA provider will only use encrypted tools. They'll train their staff regularly on HIPAA best practices. And they'll help you track who's accessing your patient data, when, where, and why. Every one of our virtual medical assistants is trained in real-world HIPAA workflows. We don't just talk compliance, we live it. From encrypted communication and platform access to constant training and accountability, we're here to help your practice scale securely. Yes, you can absolutely use a virtual medical assistant and stay HIPAA compliant, but only if you do it right. Because HIPAA isn't just about avoiding penalties, it's about doing right by your patients, every single day. If you're ready to bring on a VMA and keep your practice both efficient and compliant, check the link in the description to learn more. Let's take the admin burden off your plate, without ever compromising patient trust.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.